The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, and also encourage you to continue participating in the program by calling 718-960-7241 with any questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the topics that are of interest to you. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx, Lebanon, and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx, Lebanon's Vice President and Medical Director, and I will be discussing diabetes with a specific focus on available treatment options and educational initiatives.
Yes, Errol. Diabetes is a disease that impacted almost 20 million people in the United States in 2011. It has impacted, what have you?
It's impacted about 8% of the population.
Impacted about 8% of the population.
Right.
The good news, however, is that this disease can be monitored and controlled. Joining us this evening are two highly experienced experts in the field. Diana Malkin is the Diabetes Healthcare Coordinator at Bronx Lebanon Hospital, Bronx Care Diabetes Center, and Molly Medley is a registered dietitian and certified diabetes educator at Bronx Lebanon also. Good evening.
Right. Now, before we hear from both of you, let me once again encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241, and please call us. Now, let me begin the program, Ms. Malcolm, by asking you to share with our viewers the definition of diabetes, as well as provide them with an overview of what it's all about.
That's a great question. Thank you so much for asking that. And I think a lot of people are a little confused about exactly what diabetes is. It's a chronic but, however, manageable disease that we can manage with diet and lifestyle modification with exercise. Okay, it does affect, blood sugars. It can cause hypertension or hypertension and lipids, significant lipids that are elevated can cause blood sugars that can go out of whack. So, we want to control our blood sugars in a very significant way.
Now, Dr. Gums mentioned that it affects about 8% of the population. Is that a number that's starting to grow, or is it remaining level?
I think overall it's been staying steady. However, what's going on is our pediatric population is growing because of our the epidemic of obesity.
Right.
And what we're now seeing is that pre-diabetes is huge, to a number of 79 million people in the United States. So I do encourage everyone to seek annual physicals. They should come to Bronx, Lebanon for care. We have a lot of very credible primary care physicians and endocrinologists to care for people.
What do you mean by pre-diabetes?
This is where somebody who doesn't have diabetes,
what are some of the, for example, what are some of the warning signs for the population? If I'm a teenager, 18, 19, what would tell me tonight that I should be
if somebody is overweight for their height, not necessarily for their age, but definitely for their height. They should be getting a physical every year. If they're seeing that, and the doctor is checking and they have blood sugars in their urine, yeah, they definitely need to see. Yes, of course.
Yeah.
But some of the, being overweight, not being physically active, eating unhealthy food items, fried food, goes on and on and on.
Okay. Expanding a little on Mr. Schneer's question, can you also identify various types of diabetes for us?
Yes. We generally see in the population type 1 diabetes, which used to be called juvenile onset years ago. And we also have type 2, which is now called adult onset diabetes.
But type 2 is also coming in a younger age.
It's coming
now.
at a
You want
younger
to elaborate
age.
a little bit on that?
Yes. We're seeing more type 2s in young children.
Yeah.
As young as
More or
10
less
and
like
11
matures,
years old, as Ms. Malkin just mentioned, because of the obesity factor.
Yeah.
And we also see in pregnancy gestational diabetes, which only happens during pregnancy. During the 24th to 26 weeks of pregnancy, we are seeing more women from certain populations with diabetes.
Yeah.
Primarily Latino, African American communities where they may be overweight before the pregnancy. We're seeing a very high risk.
Okay. So this prediabetes is really something that I think we should emphasize.
It's very serious.
It is.
Very, very serious.
It
And
is.
there are a lot of people walking around, not necessarily in this borough, well, the entire country, walking around, they don't even know that they have the symptoms or they think those symptoms are normal. Weight loss, feeling lethargic, just not feeling good overall. And they may blame it on work, like they're working too hard.
And stress.
Yes.
And stress, yes, absolutely.
Right. Now, can diabetes itself...
I wanted to mention one more thing. Family history we didn't talk about.
Yeah, I know, yeah.
Family history is a primary risk factor for prediabetes.
Yeah.
If your
Yes.
grandparents or mother and father have diabetes, you're more so at risk for it.
Yeah. Okay.
Now, can diabetes itself be cured, or is it a long-term chronic disease that must be continually monitored?
I've seen a lot of my patients come off medication because they've worked really hard on their lifestyle modification, which is eating really healthy, losing, if they just lost 5% of their current weight, we can see their blood sugars being in that much better control or a tighter control.
But you want to emphasize that it's a lifelong struggle, though.
It is a
to control it.
lifelong, chronic, however manageable disease, yes. So is it curable? No. Is it manageable? Yes. However, what I want to emphasize is to get people in to see their primary care physician.
And exercise.
And
Yes.
exercise.
Well, let's discuss a little bit about the treatment options that are effective for a diabetic. You want to tell us about this?
Okay.
If someone is a diabetic, they come to see you, what are my options? What is the first visit? What first or second visit?
Well, as an educator, I would like to emphasize lifestyle, which is very important.
Yeah.
Changing how you eat, your diet, getting regular exercise and activity, which doesn't mean going to the gym. It means just walking, increasing your steps basically every day from what you were doing before. Yeah. So those two factors are something that's very important when they come to see me as an educator. But I also need to assess their readiness to learn.
What about eating? Eating habits.
Is very important. Depending on the patient's background and lifestyle, I have to first see how they're currently eating. Yeah. If they were eating, rice and beans every day, I can't tell them to now have cottage cheese and fruit. But I want to modify how much they were eating and give them healthier ways to prepare the rice and beans.
Bread is also as bad as rice sometimes.
Well, it's the same starch, but
I want you to bring it out.
Well, I'd like to mention that whole wheat bread is preferred, 100% whole wheat bread, not multigrain or white bread, because whole wheat bread slows the rise of the blood sugar and is healthier for you in general. But the amount you eat also has to be modified.
I hate to give you a little controversy, but what about the bottles of soda?
Well, that's a big controversy now in the market, and my general opinion on sodas is if you're going to have consumption, everything that has sugar, it has to be modified, the amount you have.
Yeah.
I'm not going to tell
That's good enough. Okay.
Yes.
Well, actually, can I?
Sure, you want to get in
say
trouble?
Something?
Okay.
Yes, I will. If it was up to
I'm
me, I would take every single person off of sugar in the borough of the Bronx. Yes,
Okay.
absolutely.
All right. Mayor
On that note, you kind of touched on it. Why, in your opinion, is there such a high incidence of diabetes in our Bronx community?
If we're just talking about this borough, is
Yes.
because
Yeah,
we
this borough,
don't have
this borough,
enough
yeah.
activity, and I believe the availability of really healthy food is limiting. However, right
Well,
outside
that's
our
not true. There,
right
don't you
outside,
think?
I was just going to say,
Yeah.
right outside our hospital, we do have the farmers market,
Yeah.
and I think it's really significant. And I encourage everybody, whether it's employees of the hospital, our patients, the people of the community, to take advantage of the produce in the farmers market.
But don't you think
It's wonderful.
education in some way would help also?
Absolutely, that's what we're at the hospital for. There are a total of now 4 registered dietitians, certified diabetes educators at the hospital. And that's very significant.
Okay.
Okay.
What is considered normal blood sugar? It seems to be varying from year to year. What's the range of normalcy? When do you take your blood sugars?
Well,
And you're not talking to me, you're talking to
those
someone
are
who's out
two
there.
questions. Somebody who does not have diabetes, they don't necessarily have to check their blood sugars, but really anywhere from 60 to 120.
What is the
Okay.
blood sugar, just for everybody in our audience?
What is a
What
blood
exactly
sugar?
is a
Yeah.
blood sugar? Yes.
What do you mean by blood sugar? You're talking to somebody out there now. You're talking about blood sugar. What does that mean to?
Well, somebody who, if we're talking about pre-diabetes, let's just talk about that. Somebody who has pre-diabetes, if there's a specific assay, it's a percentage. It's somewhere from 5.7 to 6.4%. So those are blood sugars where I want somebody to wake up in the morning and they should have a blood sugar under 100. That is someone who does not have diabetes. Somebody who wakes up and it's over 100 to 120, that is, pre-diabetes. If they're checking their blood sugars, let's say 2 hours after they eat, it really should be under, 140. So.
Okay. Go ahead.
What does hypoglycemic mean, and how does that compare to, how does that tie into diabetes? We hear that term.
Hypoglycemia is usually there's a risk of hypoglycemia depending on the medication that they're on. Let's say if we're talking about insulin.
Right.
Somebody's always at a risk of low blood sugar, and when we say low blood sugar, it's any blood sugar under 70.
Since you're so controversial, I have to interrupt you. We have a question. Christine, you have a question for these young ladies?
Yes, thank you.
You're welcome.
My question is, when there is a family history of diabetes, can one assume that it will pass?
I have a family history.
Yes, absolutely.
Yes.
So
Can-
let's say I have a family history.
Yes.
Not me, but
Yes.
and I'm a 18-year-old. Should I start coming or when? When should I become?
If you're overweight
Yes.
and you know you have a very poor dietary history, those are 2 risk factors already that have put you in that group to become diabetic.
Yeah.
Then yes.
What what about a baby? Expecting a baby?
Well, if you're having a child and your grandparents or your mom is diabetic, you're also at risk for gestational diabetes during the pregnancy.
And you probably should be more careful during
And you're
the
going to be
pregnancy.
monitored during the pregnancy. What we try to do is have them screened if they have a family history in the first trimester.
Yeah.
We
But
don't
they have
want
to
wait.
come to you first.
Well, once they're pregnant, we'll
Yes.
see them. But we want to see them before they become pregnant. That's absolutely
Okay.
correct.
All right. Thank you.
I also would like to add, though, if somebody was pregnant, is gestational, when they deliver, they no longer have diabetes. However, they're at risk for developing type 2 diabetes, and
Later
their
on.
children are at risk for developing type 2 diabetes.
Okay.
That information, unfortunately, is not passed on to mom and to the children. So, as part of our assessment, we do assess that.
Okay. Thank you very much, Christina. We have another call in. Oswaldo is a little upset. He wants to find out something. Oswaldo, you're on the air.
Yes, thank you very much, doctor. My question is, my sister uses insulin to control her diabetes, and it always freaked me out watching her take shots. Will there ever be a time where that will come in like a pill form or a different type of form where you won't have to inject
That's a good
the insulin
question.
into the body?
It's an excellent
That's a good question. Thank you very much.
Well, go ahead, Dan.
Oh, you-
Well, to answer the question, I'm thinking of, first of all, the reason we do take insulin in an injectable form is because we can't take it in a pill form. It's just how the body absorbs it and processes it. At one point, there was a study where people were taking insulin, inhaling it, and that didn't work out, and that went off the market. So I think that's up for a lot of the medical device
Well,
companies.
there are also
and
other
pharmaceutical
treatments that are much more
Correct.
complicated, transplant and
Correct.
so forth. And
Right.
so forth. Okay, thank you very much. Oswald is off.
Now, I understand that the diabetes program at Bronx Lebanon was recently certified. What does
Accredited.
that and accredited?
Yes.
What does that mean to the general public and our patient population?
Bronx Care Diabetes Center of Excellence was accredited by the American Association of Diabetes Educators. And what that means for the community here is that we have very qualified, experienced, registered dietitians and certified diabetes educators, and that we provide a quality service to our community.
So it's
And
very
that we
important
meet
to-
specific requirements under the auspices of the American Association of Diabetes Educators. Yes.
Okay.
On that note, let's pause for a short break, and when we return, we will continue our discussion, as well as also take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241, and please call us.
Bronx Lebanon surgeons are experts in the field, bringing a diversity of skills and cutting-edge operative procedures to their patients.
But what is most important about our Bronx Lebanon surgeons is that they are responding to many difficult challenges and saving lives.
Nurses at Bronx Lebanon are also an integral part of the OR team.
We work with the surgeons in the operating and recovery rooms and are at the patient's bedside providing the necessary support and compassionate care.
In the ICU, our critical care specialists evaluate, treat, and monitor patients until they're strong enough to be transferred to a med-surg floor.
Sometimes surgical measures are necessary to breathe life back into patients, and ear, nose, and throat surgeons are called into action. Bronx Lebanon's oral and maxillofacial specialists are widely acknowledged for their expertise in all types of dental surgery.
From tooth extractions under intravenous sedation, the emergency treatment of facial injuries, to innovative implant procedures, we are clearly placing smiles for miles in the Bronx.
Bronx Lebanon is also leading the way in cardiology, dermatology, internal medicine, infectious diseases, neonatology, nephrology, neurology, pediatrics, family medicine, pathology, psychiatry, and radiology. And its Bronx Care Network, including a soon-to-be-completed ambulatory care facility, is fulfilling the hospital's essential role as doctor to the community.
Welcome back to Health Beat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. A question we often ask our panelists is to share their respective backgrounds with our viewers. In other words, what interested you in the field in the first place, as well as some of the training that you had to undergo to become a specialist in this field. And I'll start with you, Ms. Malkin.
It is a rigorous training. I am a registered dietitian. I have a master's in public health, and I'm a certified diabetes educator. In order to become a certified diabetes educator, first of all, you have to be in the discipline, whatever discipline, whether it's a dietitian, nurse, pharmacy, social worker, pharmacist for at least 2 years, and then you need to have or see patients for about 1,000 hours, and then you take an exam, and then you pass that exam, and then you have to maintain about 75 credits every 5 years. That's just to be certified. And very similar to become a registered dietitian, you need a minimum of 4 years of schooling, academic schooling. I'm also getting my PhD in public health as well. And my interest in diabetes has been forever. I had a grandmother who had diabetes. She lived till 93. My mom has diabetes. So there's a history. I have about 10 years.
And she did all of that without your help.
Yes, I have about 10 years in pediatrics. And now I'm doing both adults and peds because I'm over in Poe and I'm at ACN.
And what about you, Ms. Medley?
Well, for me, I started working in the field in a clinical area.
Right.
I first wanted to actually be a chef. I went to culinary school.
Really?
And then from there, I went back to school to obtain my bachelor's degree. I'm a registered dietitian, and I also have my City.The, as mentioned before. And I have a personal history of diabetes in my family, on my mom's side of the family also. So I wanted to get more knowledge about West Indians. My background is from the West Indies, to see why the rate of diabetes is so high in our culture. And as we know, it's due to our diet and our weight. And as a City.The, I felt that I could really reach out to my community, and that's what sparked my interest to to come into the field.
Okay, obviously diet is very important.
Yes.
You want to tell us a little about the dietary requirements and the precautions someone should take?
Do you want to take that?
Okay. Well, if you have a diagnosis of diabetes, you may have heard stories of people telling you, I can't have bread anymore, I can't have juice, I can't eat rice.
Yeah.
They come to us with these complaints.
And they're angry usually.
And they're very angry. It's a very good point. They feel that they've given up and they can't eat anything at all.
No ice cream.
No ice cream. So we're here to demystify those facts and to let them know that it's an overall balance in your diet. We use a healthy plate, which is a component where the plate is divided into half vegetables, basically green leafy vegetables preferred, or salad. And the other component of the plate is your protein, the lean protein foods, which would be skinless chicken or skinless turkey or fish or beans. And then the other quarter of the plate is the carbohydrates or starches. These are the foods that raise the blood sugar. And if consumed in large amounts per meal, that person will have a 2-hour blood sugar, which is above 140.
Right.
So we really counsel on the carbohydrate component of the diet.
I also just want to mention, excuse me, is
Yes.
that it's almost a blessing that it's a wake-up call when someone is diagnosed or have prediabetes, because it makes them rethink and reevaluate the way they've been eating or lack of activity. So, it's a good thing.
Right. Now, on that subject of activity,
yes,
what types of limitations, if any, do individuals with diabetes have to undertake?
That's very individualized to the patient. If you have someone that has eye damage, we're not going to have them doing exercises that have them jumping up and down to create more damage. Someone that's morbidly obese, and if they have problems with neuropathy of their feet, it's very limited. It may just be, sometimes they can swim if they can't walk. Whatever they can actually do, we make it very comfortable for them and what they would like to do also.
Right. But the diabetes itself doesn't prohibit them from participating.
It sure, no,
absolutely
it does not. We encourage the activity. We really do.
I mean, look at some of the Olympians, okay, that have diabetes. That's amazing.
Yes.
There's a history of athletes, boxers, swimmers, bikers. There's Team 1. Every single bicyclist has type 1 diabetes. So it's quite remarkable,
Great.
yes.
If someone is a diabetic and they just ate your diet, what blood sugar do you think is acceptable when they take their blood sugar afterwards? Because this is part of what people do.
According to I have to quote the American Diabetic Association, or that organization, they recommend a 2-hour blood sugar to be less than 180. Now, another organization has quoted a 2-hour blood sugar to be less than 140. So once again, it's individualized to the patient, because some patients may never attain a blood sugar fasting of less than 140. But if they can give me 150 or 160 and their fasting blood sugars are within normal range, we work with the patient and we encourage them. Because sometimes when you're too hard on a patient and too stringent, they really go the other way.
Go your way, yes.
Yes.
However, I also have to mention, and I do agree with that, but with all due respect, the reason we do have an A1C in this country of 8% of higher is because we are allowing our blood sugars to be too high for too long. So really, we do encourage our 2-hour postprandial, 2 hours after a meal, to be under 140. But again, agreeing with Marlene, depending on the patient, we don't want them so low where we do experience hypoglycemia.
Okay, I think I'll bother you a little bit. This A1C, hemoglobin A1C, what's that? And make it simple for someone who probably has an 8.3.
When someone has an A1C, this is a very sensitive assay. We test somebody's blood every 2 to 3 months. It's one of those, and it tells us their average blood sugar over the last 2 to 3 months.
What's acceptable?
So what we want is anything under 7%, closer to 6.5, which is an average blood sugar of 140. 7% is an average blood sugar of like 150, 152. Mm-hmm. So really, if we really want to get this country under 8%, I give my patients homework. So we talk about the A1C, we talk about checking blood sugars, and if no one's checking blood sugars, then it's hard to manage her.
Seems a little restless. Go ahead.
No, the question I really wanted to ask you, what are some of the successes that you've experienced? I think that's a question that we always like our panelists to share with our viewers, because there's obviously a very optimistic side to the diabetes treatment and monitoring.
Yes. I think you said you had a patient you wanted to share.
I had a patient that I saw a couple of weeks ago that was very hesitant to see me. She came into my office and she was not very happy. Her overall A1C was very, very high. And she was very negative. She thought it was hopeless for her. And she had no idea that I was going to impart so much knowledge to her, checking her injection sites where she gives her insulin. Small things that would help to improve her diabetes. And I asked her to keep a log for me, and she didn't want to keep the log. But after a week of logging her blood sugars, she realized the relationship between testing and giving her insulin, and seeing how her numbers were coming down. So her blood sugars were in the 300s when I met her. They're now in the 100s.
Okay. All right.
And you know what? I have to say, these are the best patients.
Yes.
When they come in, I love those challenges. And the fact that Marlene was able to get that patient or buy into that education and buy into the care that our CDEs are providing for the community is really important.
What sort of advances do you see coming?
In diabetes?
Yes. What do you think we're talking about diabetes?
Well, if we're talking about technology, what's really out there is we have the sensor, we have a closed-loop system we don't have yet.
You're
there's
optimistic.
so much. I'm very optimistic. Very optimistic.
Technology. What about the bionic pancreas?
Right. And on that note, we have to say thank you to both of you for joining with Dr. Gums and myself on tonight's Health Beat television program.
Thank you very much.
And most importantly, let me thank you, our viewers, for joining with us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99-BRONX. That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night and see you next week.
Bronx Lebanon surgeons are experts in the field, bringing a diversity of skills and cutting-edge operative procedures to their patients.
But what is most important about our Bronx Lebanon surgeons is that they are responding to many difficult challenges and saving lives.
Nurses at Bronx Lebanon are also an integral part of the OR team.
We work with the surgeons in the operating and recovery rooms and are at the patient's bedside providing the necessary support and compassionate care.
In the ICU, our critical care specialists evaluate, treat,